Hi, today I'm going to show you the JP drain, how to empty the drains and record the amount of drainage you get. First, it's going to be pinned to the patient, usually the garment, whatever the patient's wearing, with a safety pin. We just unpin it, make sure you close it so you don't stick yourself, and if the patient's had more than one drain, we'll have them numbered, number 1, number 2, 3, 4, so have you, on the little tab here. After you do that, the first step is to strip the tubing. You want to pinch the tubing as close to the patient as you can, and with the other hand, pinch and pull down, kind of like a milking maneuver, just kind of working your way down. I like to do it 2 good times. Sometimes you'll see some drainage in the tube. It's okay, you don't have to make sure you get all of that out of there. 2 good times, make sure you're not putting any pressure on, pulling it out. After you strip the tubing twice, you want to open the drain at the top here. Looks like a little beach ball. Just kind of pop it open, and you can see it release the suction. On the bulb, I tried to write where the lines are. It'll tell you 25, 50, 75, 100. That's cc's or milliliters. Just kind of hold it upright and see how much drainage you estimate is in there. We're gonna pretend and say there's 25 in here. If there was less than 25, I like to just eyeball it and say about in teaspoon size. A teaspoon is 5 cc's, just to give you an idea, okay? If it's kind of halfway, you can say 10 or 15. Totally just approximate. Okay, after you see how much fluid is in there, have a cup handy or make the patient go to the bathroom and just squeeze the fluid out in the toilet. You can flip it over, squeeze the fluid out. It's just a bloody drainage, and discard that. Next, you have to reset the drain to the suction. So squeeze it in half, take all the air out, just like this, and put the top back on there while you're doing that, because it should be reset to this suction here. That's how it draws the fluid inside, okay? What makes patients drain a lot is them getting up. Gravity just kind of gets it flowing again. The drains should be emptied at least every 4 to 6 hours, or unless the nurse indicated you to do it sooner or less than that, okay? Or if the drain is half full. You don't want a bunch of fluid in there. It's not gonna suck as well, okay? So keep them emptied. And then you just repin it back to the patient, anywhere that won't be in their way. Okay, so we're gonna pretend and say drain 1 had 25 cc's. So we'll have all the instructions at the top of this page. Wash your hands before and after. Every 4 to 6 hours is when you do all the steps, and it's all written at the top. Day 1, today's date, and then the time that we did it. 11 a.m., drain 1 had 25. If they had drain 2, 3, and 4, you just write the amounts there. And then the next time you do it, go on the next line. I just put 3 p.m. like that. We do ask that you bring this sheet to your follow-up appointment so the doctor can see how much drainage is coming out. And that's how they know when it's time to pull the drain. Okay, thank you.